Adalimumab, also known as Hulio, CF, is used to reduce pain and swelling caused by certain types of arthritis, such as rheumatoid, psoriatic, juvenile idiopathic, and ankylosing spondylitis. It is also used to treat certain skin disorders, including plaque-type psoriasis and hidradenitis suppurativa. This medication works by blocking a protein called tumor necrosis factor, TNF, in the body's immune system, which is responsible for causing joint swelling in arthritis and red scaly patches in psoriasis. Adalimumab belongs to a class of drugs known as TNF blockers, and by reducing joint swelling, it helps to prevent further joint damage and preserve joint function. In addition to arthritis and skin disorders, adalimumab is also used to treat certain bowel conditions, such as Crohn's disease and ulcerative colitis, as well as a certain eye disease called uveitis. It is important to follow the prescribed dosage and take this medication at the optimal timing as directed by your healthcare provider. Before you start using Hulio, CF, 40 mg per 0.8 ml subcutaneous syringe kit, make sure to read the medication guide and instructions for use provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. If you are using this medication at home, learn all preparation and usage instructions from your healthcare professional and the product package. Before using, check this product visually for particles or discoloration. If either is present, do not use the liquid. If you are removing this medication from the refrigerator, leave it at room temperature for 15 to 30 minutes before injecting. Do not warm up this medication any other way, such as by heating in the microwave or placing in hot water. Clean the injection site with rubbing alcohol before injecting each dose. Change the injection site each time to lessen injury under the skin. New injections should be given at least 1 inch, 2.5 cm, from an old site. Do not inject into any areas of the skin that are sore, bruised, red, or hard. Use this medication exactly as prescribed by your doctor. Inject this medication under the skin on the thigh or abdomen, usually every other week or once a week in some cases. The dosage is based on your medical condition and response to treatment, and in children, the dosage is also based on weight. If you are using this medication to treat certain conditions, your doctor may prescribe a different schedule/higher dose at the start of your treatment. Carefully follow your doctor's directions for using this medication. Make sure to store and discard medical supplies safely. Use this medication regularly to get the most benefit from it. To help you remember, mark the day on the calendar when you need to receive this medication. Do not increase your dose or use this drug more often or for longer than prescribed. Tell your doctor if your condition lasts or gets worse. If you experience redness, itching, pain, or swelling at the injection site, make sure to inform your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because the benefits outweigh the potential side effects. However, it's crucial to contact your doctor if you develop signs of infection, such as a persistent sore throat, cough, fever, or trouble breathing. Additionally, it's important to seek medical help right away if you experience serious side effects such as irregular heartbeat, symptoms of heart failure, blood in the stools, mental/mood changes, severe headache, or vision changes. Adalimumab may rarely cause serious liver disease, so it's important to watch for symptoms and seek medical help if you experience nausea, loss of appetite, stomach pain, or yellowing of the eyes and skin. It's also important to seek immediate medical help if you experience very serious side effects such as seizures or chest pain. While a serious allergic reaction is rare, it's important to seek medical help if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. If you notice any other effects not listed above, make sure to contact your doctor or pharmacist. This medication can weaken your body's ability to fight off infections, which can lead to serious, possibly fatal, infections such as fungal and bacterial infections, including tuberculosis. Be sure to inform your doctor about any past, recent, or current infections, as well as any history of living or traveling in areas where certain fungal infections are common, or being near someone with tuberculosis. If you develop signs of infection, contact your doctor immediately. Your doctor will test you for tuberculosis before and during treatment with this medication. If you are diagnosed with TB, your doctor will first prescribe treatment for this to prevent a serious TB infection while using adalimumab. Although it is very unlikely, there is a risk of developing cancer due to this medication, especially in children, teens, and young adults. Discuss the risks and benefits of treatment with your doctor, and be sure to inform them if you develop symptoms such as a fever that doesn't go away, unusual lumps or growths, swollen glands, unexplained weight loss, or night sweats. Before starting Hulio, CF, 40 mg per 0.8 ml subcutaneous syringe kit, let your doctor or pharmacist know if you are allergic to it, any Adalimumab products, or if you have any other allergies. This product may contain inactive ingredients that can cause allergic reactions. Before using this medication, inform your doctor or pharmacist about your medical history, especially if you have had recent infections, blood or bone marrow problems, seizures, certain brain or nerve disorders, cancer, or heart disease. Adalimumab can increase your risk of getting infections and may worsen current infections. Avoid contact with anyone who has a contagious infection and talk to your doctor if you have been exposed to an infection. Inform your healthcare professional before getting any immunizations or vaccinations and avoid contact with people who have recently received live vaccines. To reduce the risk of injury, use caution with sharp objects and avoid activities that may cause injury. Before undergoing surgery, inform your doctor or dentist about all the products you are using. Older adults may be at a greater risk of infections and cancer while using this drug. If you are pregnant, only use this medication when clearly needed and discuss the risks and benefits with your doctor. This medication can pass into breast milk, so consult your doctor before breastfeeding. When taking Hulio, CF, 40 mg per 0.8 ml subcutaneous syringe kit, it's important to be aware of potential drug interactions that may affect how the medication works or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this drug include other TNF blockers, such as etanercept, infliximab, as well as other drugs that weaken the immune system, such as abatacept, anakinra. It's essential to discuss all medications and potential interactions with your healthcare provider before starting Hulio, CF, 40 mg per 0.8 ml subcutaneous syringe kit. If someone has taken too much Hulio, CF, 40 mg per 0.8 ml subcutaneous syringe kit and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical help by calling 911. Otherwise, contact a poison control center for assistance. In the U.S., you can reach your local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center for help. It's important not to share this medication with others. You will need to have lab and/or medical tests, such as a complete blood count and liver function, done while you are using this medication. It's important to keep all medical and lab appointments, so that your doctor can monitor your progress and make any necessary adjustments to your treatment plan. If you have any concerns or questions about these tests, be sure to consult your doctor for more details. If you forget to take a dose, speak to your doctor or pharmacist for a new dosing schedule. Do not take extra doses to make up for the missed one. Make sure to store Hulio, CF, 40 mg per 0.8 ml subcutaneous syringe kit in the refrigerator, but don't freeze it. Some brands may be stored at room temperature, so check the product package or ask your pharmacist for more information. Once it's been at room temperature, don't put it back in the fridge. Keep the medication in its original container to protect it from light, and discard any unused portion. Remember to keep all medications out of reach of children and pets. When it comes to disposal, don't flush this medication down the toilet or pour it into a drain unless you're told to do so. Properly discard the product when it's expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.